You're listening to Health Professional Radio. My name is Wayne Bucklar, and today my guest joins me from Melbourne in Australia. He is Marijn Kortekaas. Now, Marijn is the Partner and Program Director, Asia Pacific at Physitrack. Marijn, welcome to the program.
Thanks, Wayne. Thanks for having me.
Now, Physitrack's not a name that immediately tells me what it does and what you do, so can you fill us in on what it is that Physitrack does and what geographic footprint you work in?
Yeah, absolutely. So Physitrack is a cloud-based digital therapeutic solution for healthcare practitioners, and basically helps them to create and prescribe clinical exercise programs to their patients, and also track patient adherence, pain levels, and a range of other outcomes in real time. And where Physitrack started, basically back in 2011, one of the family members of one of our co-founders had a knee reconstruction, and as part of his rehabilitation, like many other people going through rehab, was given a piece of paper with exercises scribbled on it. For him being in pain, and at the same time, in this day and age of iPhones and iPads, he was quite amazed he would actually receive a piece of paper with exercises he found hard to understand on how to perform the exercises, but also the way it was delivered to him in terms of a piece of paper. Didn't quite motivate him to complete the exercises. Again, an issue that healthcare practitioners would see with patients across the board. So he thought, well, there must be a better way. So he actually talked to one of his, family members, one of our co-founders, and together with our other co-founder, who is our CTO, a good friend of mine, started Physitrack back in 2012. So we've been around for the last 4 years and launched in Australia, the UK, the US, and also the Netherlands in 2014. We also launched in Germany with the German side, local language side, last year in 2015. And we're now used by around 6,000 practitioners around the world with close to 250,000 patients, which is quite astonishing given, I suppose, we only launched Physitrack about 18 months ago.
So if I've got the picture right here, this is replacing the printed paper, often photocopied instructions for patients who have seen a therapist, and not only is it presenting that information in a browser context over the web, but it's also then allowing the patient to interact with the system and record their progress and how they're going. Yeah,
absolutely. So Physitrack is, like I said, it's cloud-based, so it's there is basically two sides to Physitrack. So there's the practitioner side and the patient side. So practitioners, they use Physitrack either on an iOS app that we developed with Apple's help. Mm-hmm. So they can use it on their iPhone or their iPad, and they use the app to create exercise programs, but they're fully video based. And I think this is where the key element is. So Physitrack consists of around 2,200 fully narrated clinical exercise videos, and they're all recorded in high definition and also shot from different angles. So I think that the importance of videos, I think, is quite simple and straightforward when you think about it. I mean, first of all, obviously, when you educate patients on doing the exercise correctly, it's great to do that in the clinic, and of course that happens. But as soon as patients go home, it's really hard to remember, when they were listening to all the instructions during their consultation on how to perform the exercise correctly. So that's why we use purely videos to basically instill that correct exercise technique with the patient. And of course, the fact that we shoot the exercise from different angles also helps the patient to understand, the right technique. Now, if you think about that, in the end, if you look at Australia, for example, more than 80% of Australians have a smartphone in their pocket. Mm-hmm. So you can imagine patient going to a healthcare practitioner to pay in some cases $70, $80, $90 for consultation. They expect a service that is, I suppose, more relevant to how they live their lives nowadays, which obviously is increasingly mobile, app-based, and interactive as well. So that's basically what the patient receives from the practitioner. So basically a video-based exercise program that the patient then completes on a patient app called Physi app, and it's really intuitive. It's free to download for patients on iOS, Android, or through their browser. And then the patient basically follows on each day they're supposed to complete their exercises. They follow their prescribed exercises. They watch the videos, so have a clear reference. And after each exercise, the patient ticks off how many sets and reps or kilograms they basically completed, and also indicate what their pain or their ability level was of the exercise they completed. And they can leave feedback for the practitioner as well. So it's really about, I suppose, creating that transparency and feedback loop between the patient and the practitioner. And then also with some built-in reminders for the patient to obviously keep them on track with their program as well.
You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today is Marijn Kortekaas, who's the Partner and Program Director, Asia Pacific for Physitrack. And we've been talking about Physitrack, which is a device used by physiologists, osteopaths, chiropractors, physiotherapists, that presents an exercise program in an audio-visual format over the internet on a tablet, iPhone, or browser. Interestingly, this is, I guess, one of those success stories where technology has entered the health world relatively seamlessly and with great success. Marijn, what do you think has been the key to getting this adopted by so many practitioners and so many patients? Good question.
Yeah, so basically for, obviously patients nowadays, again, walking around with a smartphone in their pocket, they want to see progress in the way they consume basically anything in life, whether it's healthcare or, whether it's transport. If you look at the taxi industry, for example, obviously, Uber has really taken advantage of, some of those elements where consumer demand was really around, I need some sort of mode of transportation right here and now. I want to see who's available, and I want to be able to book something right here and then. Same with the accommodation industry. If you look at Airbnb, for example, it's all about transforming some of the traditional industries that are around. And healthcare, in general, can be from time to time somewhat more conservative than other industries. But at the same time, practitioners also notice that, there's certain demand and expectation from the patient side on I suppose, how they receive healthcare and in which format. And on the practitioner side, of course, technology has already improved a lot of aspects of, let's say, the processes within clinics. So, a lot of clinics moving from paper-based filing to practice management systems. Moving from local service to cloud-based services. So obviously gaining a lot of efficiencies there and really saving them a lot of time. And the prescribing of exercises is obviously, just a part of the overall equation for practitioners. But they've really noticed that, the feedback from patients in general is super positive. And some of the key things that we've seen is that, the fact that patient adherence to their exercises just increases, so much by using apps and making it really easy and really intuitive for patients to complete their exercises. In a way, it's a huge value add for patients to receive that service instead of a piece of paper. And obviously, practitioners acknowledge that, and they really see it as a great selling point for them to adopt the latest technology. Hence, they come running to us in large droves.
Well, it's an excellent problem to have when you're in business, I think, is having patients and customers coming running to you in large droves. Marijn, many of our listeners are clinicians of one kind or another, mainly in acute care and in aged care. Is there a message you'd like them to get today as a result of having heard you on Health Professional Radio?
Yeah, absolutely. It's interesting you mentioned aged care, I suppose, because even the older generations are actually quite tech-savvy nowadays, and we have many 60, 70, 80-year-olds that are very comfortable in using iPads and tablets around, and are actually motivated a lot more to actually do the exercises by having an iPad, being able to click on a button and be able to watch a video, and of course the fact that it's video-based, it really stimulates their brains as well. So there's a lot of aspects to it, and again compared to paper. That really, I suppose, keeps people active, keeps people actually wanting to do their exercises. So I think from that point of view, I think that there's a huge win. I think on the other side, if you look at acute care, we work with, in terms of the kind of professions, I suppose, anyone from again physiotherapists, exercise physiologists, but even surgeons as well. So if you look at some of those areas, hospitals, for example, in terms of healthcare in general, of course, there's a huge pressure on the healthcare system in terms of cost, in terms of the aging population. So how can we, through technology, how can we alleviate some of that pressure by creating more efficient processes, by getting people better quicker, by really helping, in particular, larger hospitals, for example, save significant resources by, again, getting people just back on their feet a lot quicker. And we have some great examples with hospitals here in Australia, but also overseas in the UK, where by using technology like Physitrack, I've already seen a huge speeding up of recovery. Of course, the fact that people can do their exercises at home, don't have to come into the hospital every week for a checkup, because the practitioner can actually monitor the patient remotely. There's some huge wins on the patient side as well. So I think overall, it's all about creating, I suppose, less waste and greater efficiencies in the overall healthcare system.
Marijn, is there a misconception amongst your clients or customers or patients that drives you nuts and keeps you awake at night?
Misconceptions? Not really. I mean, sometimes you hear people wonder whether we, I suppose, as a technology solution, whether we try to replace practitioners and say, well, patients can jump onto Physitrack and just pick and choose some exercises. That's not what we are. We are really an extension, I suppose, of the service that practitioner provides to the patients. And as you said, if anything, we're a replacement of the old paper handout with a few stick figures drawn on it, and really, again, offering patients a lot better service. And practitioners, of course, makes them look fantastic because they really offer the latest technology, and patients really appreciate it as well.
Marijn Kortekaas, Partner and Program Director, Asia Pacific for Physitrack. It's been a pleasure talking with you today. Now, I'm sure we will have startled some people into going, wow, this is amazing, I need to find out about this. What's the best way for people to get more information? The best way would be to visit our website, so www.physitrack.com. It's got everything in terms of information and some good videos as well on how Physitrack works. So I would love to see people come and visit. So that website again was www.physitrack, Physitrack, all one word, physitrack.com. Marijn, it's been a pleasure having you with me. I realise you're a busy person. Thank you very much for your time. Thanks for having me, Wayne. Thanks a lot. Cheers. If you've just missed my conversation with Marijn Kortekaas of Physitrack, the good news is we have a transcript on our website. We also have an audio archive on both SoundCloud and YouTube, and you can find the links to all of those things on the Health Professional Radio website at www.hpr.fm. Thank you for listening to Health Professional Radio. My name is Wayne Bucklar.